Patient and sample flow and overview. As per the existing RNTCP diagnostic algorithm, the symptomatic for pulmonary tuberculosis, either self-reporting or referred, visiting the treatment center or DMC, shall provide two sputum samples, sample A and sample B, for the smear microscopy examination at the DMC. The registration and documentation procedure at this stage continues as per existing practices. The lab technician at the DMC conducts the smear microscopy examination. If the result of the smear microscopy turns out to be positive for Mycobacterium tuberculosis, then the patient is a probable intake for the drug resistance survey. All smear positive pulmonary TB patients, either new cases or previously treated, who have been identified at all DMCs of the TU would be eligible for enrollment in the drug resistance survey till the required sample size of 27 new cases and 17 previously treated cases are achieved. The DMC LT shall call the STLS by telephone and inform the patient's details to him. The STLS shall make an entry of the patient in the STLS patient log diary. This information would be handy for the STLS for coordination with the patient, DMC LT, MOTC and patient retrieval if and when required. Care should be taken by the STLS to enter the patient details initially in the STLS patient log diary and not the NDRS register at this stage. When the patient comes to collect the smear microscopy result, the lab technician will explain about the survey and also the benefits of conducting an advanced diagnostic examination such as drug susceptibility test by giving 2 additional sputum samples. He asks the willingness of the patient to participate in the survey. If willing, the lab technician will issue an empty falcon tube to collect the overnight sputum sample D at the patient's residence just prior to visiting the MOTC. The lab technician shall also issue a patient referral slip to the patient with the detailed address of the TB unit and contact information of the medical officer of the TB unit and STLS. The lab technician shall educate the patient to carry all relevant medical records to the doctor for examination. The patient shall collect the overnight D sample and visit the MOTC with the referral slip and medical records. He shall hand over the referral slip to the doctor. This shall help the doctor to identify the patient as a probable intake for the National Drug Resistance Survey. The medical officer will explain to the patient about the survey and obtain informed consent from the patient with his signature. After obtaining the consent, the medical officer will fill the clinical information form by interviewing the patient and also reviewing the medical records and then declare the patient as either a new case or a previously treated case. The medical officer shall then retain in safe custody the filled in CIFs till the STLS collects the same from him. Based on the interview and review of the medical records, if the medical officer is not able to classify the patient as either new or previously treated, then such cases may be recorded as status unknown in the CIF. Such cases of unknown TB treatment history are dropped from the survey. For such cases, the D sample obtained are collected and discarded as per procedures. The C and D sample collection and transit of CIF to NTI is not recommended. The process of patient intake continues till such time that 27 new cases and 17 previously treated cases are obtained from the selected TB unit. The medical officer, after completion of CIF, shall then direct the patient to meet the lab technician. The lab technician at the collection center will collect the referral slip and overnight sample D from the patient. In addition, the lab technician will collect a spot sample, sample C, from the patient. He shall then record the date and time of early morning D sample collection by reconfirming from the patient. This information shall be recorded on the referral slip in the appropriate columns. The date and time of spot sample collection, sample C, is also recorded on the referral slip. The number mentioned on the referral slip may be indicated on the Falcon tube caps to relate and identify the samples temporarily. The LT will perform surface disinfection of both the Falcon tubes by dipping the tubes in 5% phenol for 20 minutes, after which the tubes may be removed and allowed to air dry. The corresponding referral slip and Falcon tubes are then handed over to the STLS for further needful actions. The STLS collects the completed clinical information form and the C and D samples. He checks the answer to question 41 on page 4 of the CAF to confirm the classification of patient as either a new case or a previously treated case. Based on the classification, the STLS enters the patient details in the relevant section of new or previously treated case in the DRS register. The STLS writes the date and time of C and D sample collection in the space provided on the stickers in the NDRS register in the 24 hours format. Care should be taken to write the date and time in the box provided without overwriting on the barcode. The Nikshay copy of the CAF is then separated. The Nikshay copy of the CAF will be retained at the TB unit and shall not be sent to NTI. There are 5 stickers provided for each patient in the NDRS register. The first sticker should be stuck on the C sample Falcon tube. The second sticker should be stuck on the D sample Falcon tube. The third sticker should be stuck on the NTI copy of CAF. The fourth sticker should be stuck on the written consent form found inside the CAF. The fifth sticker with only the patient ID and no barcode should be stuck on the Nikshay copy of the CAF. The STLS should then cross-check the contents to be dispatched with the checklist printed at the end of the CAF before commencing the packing. C sample Falcon tube of the patient with the correct barcode sticker affixed. D sample Falcon tube of the patient with the correct barcode sticker affixed. Completed CAF with the signature of the MOTC clearly indicating in question 41 as to whether the patient is a new case or previously treated. Barcode sticker on the NTI copy of the CAF. Barcode sticker on the consent form of the CAF with the patient's signature. Packaging should be performed as per routine RNTCP practices which are described in the PMDT guidelines. The consignment is then handed over to the courier agency to deliver the same to NTI Bangalore. The package needs to be couriered in cold chain and should reach the NTI laboratory within 72 hours of sample collection. The courier needs to be delivered to NTI between Monday to Saturday between 9:30 AM to 6 PM. The STLS shall then enter the details of the consignment number and the date of handing over the consignment to the courier agency in the NDRS register. This procedure shall repeat till the required sample size of 27 new cases and 17 retreatment cases shall be registered. STLS will be responsible for all the above activities. MOTC, DTO and STO will ensure proper and timely dispatch of samples to NTI Bangalore.